point, I want to bring up our next speaker. Commissioner Varney and Marie Williams, the Deputy Commissioner, were not able to be with us this evening, and they send their regrets. But Rod Bragg, the Assistant Commissioner for the Division of Substance Abuse Services at the Department of Mental Health and Substance Abuse Services, you got to shorten that name, is agreed to address the group on their behalf. So we appreciate it. Rod, can you join us?
Good evening. Hey, hello, people. Okay, that's better. Get some excitement going. Commissioner Varney and Deputy Commissioner Williams really regrets that they couldn't be here tonight. They're actually in Washington, D.C., and so they were very sad when they realized they had to go there and couldn't come here. So they send their regards and their best wishes for everyone, and we're happy to be here. So it is a pleasure to be here. I look forward to this every year. I always have a good time. It's great seeing providers that I know. It's great meeting new providers that I don't know. And so thank you all for being here. It really is a pleasure. And thanks for all you do. There are millions of people suffering with addiction and co-occurring disorders. And the work that you do day in and day out is priceless. It's not the easiest work. I know that firsthand because I worked in the community substance abuse and mental health agencies for years. It's not the highest pay, but yeah, you're laughing about that. Yeah, but the pleasure of working with people and watching them grow into a life of recovery, into a life of stability, into a life of moving forward in their life. That's the greatest reward, I think, that we can receive. When you watch that poor little woman or that man who they just can't move forward anymore in their life, they're at the lowest point in their life, they don't know what to do, they don't think there's much hope left, and you all take them in under your wings and help them bring themselves back to health. So for that, thank you. I just wanted to mention a little bit about a couple projects we're doing at the department. One is we have created a heroin stakeholders work group. Mary Linden serves on that committee and some providers as well. And as you know, probably better than I do, heroin is on the increase. 2009, 1.5% of our clients coming into treatment were there for heroin abuse. Last year, it was 9.2%. So it's growing rapidly. And we at the department want to see what we can do, and we're working with other departments and state agencies as well to get a better handle on this. You know, a lot of work, you all have done a lot of work on prescription drug abuse. Now we're starting to see that go down, but the heroin's going up, and it's pretty predictable. We're hoping that the heroin work group will come up with some strategies that will be helpful to you in the community. So if I want to leave one thing with you, and that is that there's hope. There is always hope. And I think that everybody in this room's first name should be Hope. I mean, Paul, that's a little tough to call you Hope, but sometimes I think that the only thing we offer our clients is that much hope. And that's all they need to hang on to. They come in with very little hope, with very little sense of that they're going to be a productive citizen. And you reach out and hold them and uphold them and offer them hope and a way of living a new life. and that is really God's work. You're all doing God's work. So thank you all. It's a pleasure to be here with you.